Hello everyone and welcome back to my channel. I am Dr. Indrima. This is one of the awaited videos in which I will discuss about whether you should consider MD Pathology as your career or not. Now, since I will talk about every little practical aspects in detail, that is why I have divided this into two videos. This is the first video in which I will discuss essentially the pros of pathology, why you should consider this as a branch, and in my next video I will discuss about the cons of pathology. I would request you to very importantly go through that video, because once you become familiar with the cons and you can accept those, only then go for this branch. I will also post a third video in which I will discuss about the hazards or difficulties that a resident faces in pathology, and I am very sure if you can manage yourself and accept all these cons and the hazards, then congratulations and welcome to pathology. Okay, so starting with the first point, pathology is an upcoming branch. It is always in demand. Yes, so nowadays pathology is basically a subject which is the barrier between clinical and non-clinical. It is the top branch among the non-clinical subjects, and believe me, behind every successful clinician there is a very good MD pathologist. So you do not consider yourself inferior or anything less than a clinician whenever you make a diagnosis. As you know, pathology is a diagnostic branch. Whenever you make any diagnosis, you have to look at it from a very clinical aspect, and keeping in mind whatever points you know about that subject clinically, you should also apply them when you make a full diagnosis. So I would like to tell you that because it's a diagnostic branch, it is very popular in foreign countries. Yes, because I will tell you the reason. You will see that foreign countries में पैथोलॉजी बहुत पॉपुलर है, और वहाँ पर पैथोलॉजिस्ट लेने के लिए, स्टडी करने के लिए, you need to have a very good rank. ठीक है, वहाँ पे गुड रैंकर्स एंड टॉप रैंकर्स दे गो इनटू पैथोलॉजी, क्योंकि इन फॉरेन कंट्रीज पैथोलॉजी इज गिवन दैट मच अमाउंट ऑफ रेस्पेक्ट, बिकॉज diagnosis is very important there. In India, what happens, we don't give much importance to diagnosis, we give more importance to treatment, and that is why I personally believe in India the healthcare facility, the standard of healthcare facility is comparatively low as compared to foreign countries, because we don't give much importance to diagnosis. अगर diagnosis सही से नहीं होता है, then how will you treat the patients? So in foreign, they especially give more importance to diagnosis and diagnostic modalities, to first identify the disorder and then they go with the treatment. That is why over there pathology is one of the top branches, which is not so in India. Since pathology is an upcoming branch, therefore there is always a demand of pathology. You will find in the near future many new upcoming things will also come, new fellowships will also start, and I will assure you that, see, nowadays in every tier 1 and tier 2 cities and tier 3 cities, always labs are coming up, because in any nursing home, like if you say nursing homes and all, obviously they will need a lab from where they will get the reports done, है ना? तो like nowadays छोटे मोटे काफी सारे labs जो है, they are like coming up like mushrooms. So getting a job in a laboratory in a private lab is not that difficult. चाहे वो किसी भी तरह की लोकेशन में आप हो, getting a job is not a problem in pathology. But if you want to get a job in, let's say, well-known labs like Lalpath, then Thyrocare, or things like that, and in top positions like Tata Medical Centers and all, if you want to get a job over there, then you should not only have MD as a degree, you should always and also follow it up with DM or fellowships. Okay, so I will talk about those in detail, but I want to first let you know that pathology is a branch where there is never a scarcity of job. Wherever you go, at least I will tell you the pay scale. See, obviously pay scale will vary from state to state. I will talk about my state, you get an idea about that. So in here we have a part-time and full-time. So full-time के लिए at least you will get 90,000 के आसपास per month. Okay, and the working hours is 8 hours. Usually the timing is from 10 to 5, so for full time you will get 90k round, and in top labs you may also get up to 1.2 like that. And if you are working as a part-time, then for every 4 hours you will be paid 40,000 per month. So it's like that. So it's negotiable also. You can work in 2 labs and 3 labs like that. So you can easily earn up to 1.2 1.5 के अंदर आपका जो salary amount है total वो आपको मिल जाएगा, ठीक है. Now pathology is an academic branch, so you have to understand that you have to read a lot. As opposed by other people, I would like to mention that pathology is a very vast subject. It needs a lot of intellect. If top students and top people do not come into this branch, how will this branch flourish? Because you need a lot of intellect, a lot of intelligence to diagnose. It's not at all easy. There's little subtle details and differences amongst each disorder. We usually deal with cancers over here. What we do in residency, that is a different video. I will post that later on. Lekin what I want to tell you is that this is a very intriguing subject. You need to have a lot of understanding, and you have to keep reading. You also have to keep working, seeing slides side by side. So it is not an easy job. It is not something that is easy कि कोई भी ले लेगा और हो जाएगा, इतना आसान नहीं है. लेकिन what people usually do is they do not go for histopathology. They don't do that sector well. What they do is, usually what I've seen people doing, they kind of run their own clinic and own chamber in the name of MBBS MD. Then they get associated with labs where they only sign kind of hematology reports and other reports like from biochemistry and all. But histopathology is difficult. No, it's not everyone's cup of tea to do that, because you need to have a lot of understanding and knowledge to do histopathology. And in good labs you do have all facilities, and whenever you work there, that's where you get this much amount as the pay scale, because you're doing everything. You're doing FNSC, you're doing histopathology, you're also doing hematology. Hematology is the bread and butter. कहीं पर छोटे मोटे labs में भी आपको hematology में ही काम करना पड़ेगा. So you have to get used to that. Hematology में the part which is bone marrow, that is also done by pathologists. Okay, the procedure and the reporting. So you will get separate pay for bone marrow procedures and also for reporting. Once you start working in the field, you will get more and more exposure, and you will get more and more understanding कि कहाँ पर क्या होता है. So yes, so that is also an added advantage. During your course of PG, you will learn bone marrow procedures and reporting as well. That is also an added work that you will do, and you will be paid separately for that. Okay. Now another very important thing is that obviously every other branch needs you, right? No branch is complete without pathology. हर branch में diagnosis के time पे they need pathology. Like you see, like hematology, like blood cancers, then bone marrow, then surgery में तो it is incomplete without pathology, because once you do not stamp the patient cancer free, they won't be able to leave the patients. We have to make the reports, and then we have to say whether there is no cancer remaining in the body, and that's how we examine the margins, and that's how we give the status. And after that only the patients are released, and based on the type of cancer they are receiving additional treatments of chemotherapy or whatever. So every branch is dependent on pathology. Obs-gynae में भी specimens आते हैं, and from there we give they can actually make the further protocols of the treatment. So every branch needs you. Patients do not come directly to you all the time, although in FNSC and bone marrow you have got direct patient exposure. So ऐसा नहीं है कि patient exposure एकदम नहीं है. It's not like that. You do have patient exposure. Means in FNSC you will have patient exposure. You need to see all the clinical features and then come to a diagnosis. Not just by looking at this smear. You also need to have clinical inputs. So you need to learn a lot. You have to keep in mind so many things. You have to be a clinician. At the same time, you also have to be a pathologist. So it's not an easy job. If you really want to do good in this field, then you have to be very much academic. You have to learn, you have to know a lot. Okay, at the same time, whenever we give histo reports also, hemato reports also, if we find any kind of discrepancy or problem, we call the patient, we examine the patient. So it is so much clinical, but we do not have an OPD basis treatment or something like that. That's why it is called as non-clinical, but the approach and the learning is completely clinical. Now because of this less patient interaction, it is actually a boon to some extent, because nowadays the incidents that keep happening in clinical branches, you are saved from the hazards of extreme patient interaction and the consequences of that. So you do have patient interaction, at the same time you also do not have to deal with those hazards. You're not a frontline worker, so you don't have to bear up with so many hazards. You can just work calmly behind the scenes, just putting your effort and putting your mind into it, and you are learning, you are working, you're also getting paid, you're also appreciated by the other branches. So I think these are the pros of the pathology, right? Okay, now there is another point, because which is one of the points that was in my favor when I took up pathology. Pathology mein you have the opportunity to read every organ system. Okay, you will never get bored in pathology while reading. You have every option to read anything you want, any kind of cancer you want, any kind of disease you want, because every disease will need pathology. Every disease has got a pathological basis, which means that I personally get bored if I read one thing over and over again. So I need a diverse range of academics so that I can read whatever I want. So I never had a dream branch. If you ask me why exactly did I come to pathology at 11,000, I will tell you I never had a dream branch. Okay, and the things which happened in my life, the crisis period which I went through, has ultimately led me to pathology, has ultimately made me land up in pathology even without realizing it. I just knew that I had love for the branch. I am in love with the pros of the branch. I wanted a kind of a stable life and a work-life balance pertaining to the fact what happened in my life. Now what happened, that is my personal life story. I will definitely share those incidents in my upcoming videos. I will actually talk about everything from my childhood, because otherwise my life is like a story. But what you should learn here are these points which will help you to understand whether this branch is for you or not. The next thing is work-life balance. Pathology is a branch which is the most famous for work-life balance. You have an extremely good work-life balance, and you do have specific time. उसके बाद आपको कोई भी call भी नहीं करेगा. Nobody will even call you after that. It's like after that certain time, whether it's 5 p.m, 6 p.m, whatever, after that time, it's completely your life. Although I'm not saying that this is the case in residency. In residency, in my college, especially in my college, we have working hours till 5 p.m. उसके बाद हम लोगों को disturb नहीं करता है कोई. Okay, but not in everywhere. In Delhi side, you will see pathology is a very hectic, has a very hectic residency. ओके, सो रेसिडेंसी के टाइम पे 3 years का टाइम है, वो कैसे भी करके आप गुजार लो, उसके बारे में ज़्यादा सोचना नहीं है. लेकिन आगे जाके लाइफ में आपको प्रॉपर वर्क लाइफ बैलेंस मिलने वाली है. एंड स्पेशली फॉर गर्ल्स दिस ब्रांच इज वेरी गुड, बिकॉज यू कैन मैनेज योर फैमिली, योर चिल्ड्रन एंड एवरीथिंग. एंड इवन फॉर बॉयज ऑल्सो दिस इज अ वेरी गुड ब्रांच. नाउ कमिंग टू द पॉइंट विच पीपल यूजुअली आस्क कि भाई माइक्रोस्कोप है तो उसके लिए प्रॉब्लम होती है, लोगों को माइक्रोस्कोप के लिए प्रॉब्लम होती है. तो उसके लिए आई हैव डिस्कस दैट इन द वीडियो एज ए मेंशन्ड इन द वीडियो ऑफ हैजर्ड्स ऑफ पैथोलॉजी विच विल बी कमिंग अप इन अ फ्यू डेज. तो उसके लिए उसको रेफर करना है. If you have any kind of hobby, passion, whatever, you can even continue that side by side. आपको चैम्बर करना है, क्लिनिक्स करना है साइड बाय साइड, वो कर सकते हो. लेकिन उसके लिए आपको डिग्री वगैरह की जरूरत होती है. समटाइम्स यू नीड डिग्रीज जो आपको पैथोलॉजी में नहीं मिलने वाली है, उसके लिए आपको अलग से कुछ करना पड़ेगा. अदरवाइज यू कैन वेरी वेल रन योर ओन क्लिनिक. यू कैन डू योर, you do have a fixed amount coming in your bank if you join a lab. You know that this is, I have a secure life, I have work life balance. Life में if you need a stability, there is nothing like this, because job opportunities are enough in pathology. Labs are always there. अगर आपके लोकेशन में नहीं हो, थोड़ा बहुत डिस्टेंस ट्रैवल करने से ही आपको जॉब मिल जाएगा. So now I will talk about the most important thing, that is the earning potential. Earning potential में government and private. Now I would like to first tell you that पैथोलॉजी में जॉब अपॉर्चुनिटीज कैसी है. फर्स्ट ऑफ ऑल, इफ यू आर नॉट doing any kind of fellowship or DM after this, okay, then what are the options, and once you do DM and those things, then how can you improve your opportunities. So first is you have pathology is mainly a job oriented branch. Every non-clinical branch is a job oriented branch. Okay, so pathology में क्या है कि one side you have government and private. So in both the colleges you get opportunities to be a faculty or as assistant professor, associate professor, professor. These are always there, especially in government sectors and also in private sectors. Now in government sectors, what happens is in West Bengal, this is in West Bengal I'm talking about, after 3 years of MD, you need to do 3 years of residency. But if you don't want to do it, then you have to submit 30 lakhs, 10 lakhs for each year, and then you can get rid of the bond. Okay, but for getting a job in government sector, you need to do 1 year of residency in a government medical college. That is a must. So students who come from outside our state into our state, they just need to do 1 year of residency in any government college. And we have these notices coming up every time in the official website, so you can definitely check it, and whenever you get that notice, you can just apply and do an interview over there, and you will definitely get. There are a lot of seats available for residency in different colleges in our state. So once you do 1 year of residency, and those who are from this state, they can definitely do residency for 1 year continuously just after their MD, and then they become eligible. Now here I also want to tell you is that along with your MD, you also need to have, it's always better if you have a lot of other degrees associated with this, so that you get into top positions. And you also kind of during your residency, in whichever residency you are, try and do some publishing work. You can also do it during your senior residency. You can also do it later on in life also, but throughout your course, whatever course you are in, whatever branch you are in, try and do some publications, some kind of articles and all. This will actually give you the boost, so that when you make your CV, these things can be included. Another thing is that you have options of fellowships. You have multiple fellowships, and you also have DM. You can do multiple fellowships and you keep adding them to your degree, and you reach up to a point, you have work experience, you have fellowships, you have articles published. If you have these 3 things, then you can even go into top positions, like you can be the consultant in Tata Medical Center. Now coming to DM, what kind of DM should you do or can you consider after pathology? See, I will again go with the law of average and tell you that options here are, you have histopathology, cytopathology, hematopathology, oncopathology and clinical hematology. So these are the options. Now out of these options, histopathology, hematopathology and cytopathology, the seats are very less. You have maybe 2 to 3 seats maximum, and that too in the central institutes of our country. So I will not ask you to do that. That's a rarest thing, and I will not ask you कि इतना मेहनत करो और वो 1-2 positions पे आप चले जाओ, मैं ऐसा नहीं बोलूँगी. तो hematopathology, histopathology and cytopathology, these are out of syllabus, and I will not ask you to do this because the seats are very less. Okay, but oncopathology and clinical hematology, these two, the seats are more. Okay, now oncopathology is the most common DM that pathologists usually do after completing their रेजिडेंस. सो ऑन्कोपैथोलॉजी में क्या होता है, आप बस पढ़ाई करते रहना है, थोड़ा बहुत एंट्रेंस का प्रिपरेशन लेना है, और सिलेबस जो है और जो क्वेश्चंस पूछे जाते हैं वो आपके ही ब्रांच से है, पैथोलॉजी से ही है. तो इसीलिए इट इज इजी टू गेट इनटू ऑन्कोपैथोलॉजी. यू हैव मल्टीपल सेंटर्स कमिंग अप. इवन इन माय स्टेट, इन सम कॉलेजेस लाइक IPGMR and all, there are seats increasing for oncopathology, and all over the country the seats are increasing for oncopathology, and students usually get into that. And even once you do a DM in that, you can be placed in top positions, as I said, in Tata Medical Center, any top laboratories where you can be hired as an oncopathologist, and you will be paid a handsome salary for that. ठीक है, तो वो एकदम ही प्रॉब्लम नहीं है. आप जितना डिग्रीज ऐड करते रहना है उतना आपको अपॉर्चुनिटीज मिलेगी. डिग्री ऐड नहीं भी करोगे तब भी आपको प्राइवेट में, आपको लैब में आपको जॉब मिल जाएगी. इवन व्हेन इफ यू अप्लाई योर CV टू गवर्नमेंट जॉब्स, वो भी आपको एक टाइम के बाद मिल जाएगी. एलिजिबिलिटी क्राइटेरिया होने की जरूरत है बस, बाकी सब तो सही है. ठीक है. नाउ कमिंग टू DM clinical hematology, this is a branch which is actually you are entering into the field of medicine, means from pathology you are shifting into medicine. DM clinical hematology is a branch where medicine people come, and I think almost kind of 1-2 years back the exam pattern of DM clinical hematology has changed. Now there is no more a 60-40 ratio. Previously 60% of the questions were asked from pathology and 40% from medicine, but now it is completely medicine, means now the syllabus has changed. You have to read the entire syllabus of MD medicine to actually do that DM. You're actually appearing for Neet SS, and the questions that are asked are from the subject of medicine, not from pathology. That is the problem. That is why pathologists nowadays are not able to enter into DM clinical hematology, because you have to read medicine. हम लोग पैथोलॉजी पढ़ रहे होते हैं 3 साल से, तो मेडिसिन अचानक से कैसे पढ़ना स्टार्ट कर देंगे? और इतना बड़ा एक सिलेबस है मेडिसिन का, आप लोगों को पता ही है, तो कैसे मतलब उस चीज को, वो भी MCQ बेस्ड, अगेन द सेम प्रॉब्लम, तो कैसे उस चीज को मैनेज करें? लेकिन ऐसा नहीं है कि पॉसिबल नहीं है, मैरो में सब कुछ अवेलेबल है, या फिर काफी सारे स्पीड वगैरह इंस्टीट्यूट है, वहां से अगर आप कोर्स लेते हो और पढ़ाई करते हो और डीम क्लिनिकल हेमाटोलॉजी में अगर आप नीट एसएस देकर के एंट्री करते हो, तो आई थिंक इट्स वेरी गुड अपॉर्चुनिटी, बिकॉज यू विल बी प्लेस्ड एज असिस्टेंट प्रोफेसर्स इन द डिपार्टमेंट ऑफ क्लिनिकल हेमाटोलॉजी विच इज अंडर द ब्रांच ऑफ मेडिसिन. समझे? तो ऐसा भी एक रास्ता है जो कि बहुत ही अच्छा है, बट you have to put in a lot more effort because you have to read the entire medicine. Okay, so being from pathology, you have to read the entire medicine, which I think is good because you're actually evolving yourself. You're becoming a good doctor. If you kind of open your chamber or clinic, you have a lot of knowledge before you start all those things, and you have an extra degree. You have a DM degree, and over there you're actually treating those cancer patients, especially the blood cancer patients. You're doing bone marrow. Like I have a video in which I attended the posting at Interdisciplinary Medical College in our state. Interdisciplinary Medical College and Medical College Kolkata are the two institutes where they have the separate department for clinical hematology. So we as students, because at RGK Medical College hematology department is not there, so we are posted at Interdisciplinary Medical College in that department to learn the procedures which pathologists have to learn, need to learn, because in future we have that option open. So we need to know how things work over there. So we are posted there, and I had shared a video in my channel about my hematology posting at NRS, where if you see the video you will understand what we do over there. So we do bone marrow procedures, we learn reporting, and that is the entire scenario about doing clinical hematology. So you can definitely go into that, but the effort you have to put is double than the effort you put for DM oncopathology. And when you're doing DM oncopathology, the kind of work that you will be doing is completely based on pathology only. Like for example, you're doing molecular studies or you are doing histopathology studies, so these kind of things you'll be doing over here. But once you go into clinical hematology, you will only see slides based on clinical hematology, like blood cancer and all those slides, and you will be also doing procedures. You have to look after your patients, you will have your ward rounds and everything like that, because it's under medicine only. But I would like to tell that essentially pathology is an end branch. Okay, so once you finish your branch, if you don't want to do further things, that's also fine. You can just join a lab, you can just join government sectors, and you are good to go. Opportunities are very much here, and yes, as I mentioned, in some labs where they do not have histopathology, they even don't take separate MD biochemistry or MD microbiology to sign their biochemistry reports, because you know every lab will not only do hematology, they will also do biochemistry tests, because biochemical tests are very common, but they do not hire separate pathology and separate biochemistry for signing the reports. They only sign a pathologist. So pathology में job की कमी आपको नहीं होगी. That is my personal opinion. I don't know about what others will say, but because as I said, you know, my personal biased opinion based on my experience will always be reflected in all my videos. That's how it is. And that is good, because you need to know what individual people experience, right? Now, another thing I want to mention very importantly, and that is setting up your own lab. Now, setting up your own lab will come under the cons of pathology, because it is not easy to set up a lab. Lab खोलना, मैं आपको middle class family से belong करके, and you will, if you listen to my story, my life story, you will know that the amount of crisis I faced, it was even difficult for me to imagine कि मैं कभी भी जिंदगी में PG भी करूँगी, मैं ऐसे वीडियो बनाऊंगी, ये तो मेरे सोचने के भी बाहर था. तो मैं ये कहना चाहती हूँ कि अपना जो प्राइवेट, अपना जो ओन लैब है, that is not easy to open. You need a lot of funding for that. You need to have a lot of amount, lot of backup before you kind of do and jump into a lab. जो लोग बोलते हैं, I have seen a lot of career counseling videos before I joined pathology, and whenever I watched any video saying pathology as a branch, they mentioned that you can open your own lab. इतना आसान नहीं है लैब खोलना. मैं ये कहना चाहती हूँ कि जो लोग बाहर से बोलते हैं हमेशा वो सच नहीं होता है. प्रैक्टिकल लाइफ बहुत अलग होती है. If you have enough fund, if you are from a rich family, then opening up your lab is the best thing that you can do. And yes, in later future, if your lab shines in a particular place, then only the sky is the limit. You can earn up to any amount you want. लेकिन वो जो स्टार्ट है लैब खोलने का, जो पैसा है वो आपको फंड करना पड़ेगा, और उसके लिए आपके पास काफ़ी बैकअप की ज़रूरत है. एंड दैट्स ओनली पॉसिबल इफ़ यू काइंड ऑफ हैव योर क्लिनिक्स, और इफ़ यू ओपन इफ यू हैव योर चेम्बर एंड इफ यू हैव योर क्लिनिक्स साइड बाय साइड, देन yes, you must have earned enough for your lab to open. And I think people do take up this branch. A lot of people, a lot of service PGTs take up this branch because they have a backup and they are planning to open your own lab. Once you open your own lab, you become the lab director of your own lab, and then you can earn any amount you want. लेकिन उसके लिए फंडिंग बहुत ज़रूरी है. इसके अलावा आप किसी भी लैब की भी लैब डायरेक्टर बन सकते हैं. You can definitely become the lab director of any lab you want. For that, you need to have a lot of work experience. You need to have a lot of articles published. You need to have some fellowships. You also need to be in a good position, maybe an assistant professor or associate or professor working in a government job. Once you fulfill all these criteria, you definitely can also become the lab director of certain labs, and then you can understand that you can definitely amount much more than even a clinician. So you do have a lot of opportunities. It's just that, as I mentioned in all my videos, that it depends on what you do with your branch. Having said that, you can go up to any extent in pathology, or you can even limit yourself. Both ways you do have a stable life. Work-life balance is excellent. So these are the pros of pathology. But having said that, there are also a lot of cons coming with all these points, and that is the flip side of the coin, and I will definitely talk about that in just my upcoming video. So please stay tuned, and if you like this video, then please don't forget to like, comment, share and subscribe to my channel. If you have any personal query, you can mention down in the comment section below. I will try to address all of your queries. Thank you for watching.